everyone. I'm Mrs. Princey, Associate Professor in Mental Health Nursing. There are situations when the mood of a person can be disturbed, right? So, the disturbance in the mood, we can classify the disorders as a mood disorders, right? We have got two main conditions in that. One is the depression, and one is the mania, right? So, I've already described about these two major conditions under the mood disorders. Apart from these two conditions, we have got the other mood disorders which can be disturbing for a person persistently, right? So continuously throughout their lifetime the person can undergo a mood disorder condition. So today I'm going to talk about the topic persistent mood disorders, otherwise it is called as persistent affective disorders. Let us see the ICD-10 classification of persistent mood disorder. The chapter which describes about two major conditions under the persistent mood disorders, which is the cyclothymia and the dysthymia. Apart from that, we have got the other mood disorders. So the chapter F34 describes about the condition cyclothymia. F34.1 talks about the dysthymia or the dysthymic disorders. F34.8 other persistent mood disorders. F34.9 persistent mood disorders which are unspecified. So this is the classification of the persistent mood disorder. So I will be discussing about each of these disorders in detail. Number one is the premenstrual dysphoric disorder. So what is this premenstrual dysphoric disorder? It is a condition which happens wherein there will be disturbance in the mood of the client before the client attains the periods or the menses. So especially this is seen in the women or in the young adolescent girls. So what are the essential features of this disorder or the characteristics? The women will experience markedly depressed moods, excessive anxiety, mood swings and decreased interest in the activities. When exactly will the person or the lady will experience these symptoms? Usually 1 week prior to the menses. Okay, the lady experiences these mood swings or the characteristics of the premenstrual dysphoric disorder. These characteristics or the features shortly subsides after the onset of the menstruation. So that is the condition. So you also would have experience if you're a lady or a girl. So just before getting the periods for a week prior to the menses, right? So there will be a disturbances in the mood or mood swings, which later it subsides after starting the menstruation. So the next condition is the other depressive disorders. In that we have got the first one, mood disorders, so that especially the depression, which happens due to the general medical condition. So as the name says, because of the changes in the physiology, a person ends up with the medical disorder. Because of the medical disorder, he will have the disturbances in the mood, especially the depression. So you would have been recently diagnosed as having diabetes or hypertension or having cancer. So you would have seen the clients who are recently diagnosed with the medical condition which they have to, go through it for their lifetime henceforth. So in those clients, you can see that the client may have the depression or the disturbances in the mood. The second one is substance-induced mood disorder. So what is this substance-induced mood disorder? Because of the physiological effect of the substance of abuse. It can be alcohol, it can be a drug of abuse, anything, the person will have a disturbance in the mood. So these are the other depressive disorder. The next disorder is the recurrent depressive disorder. It is termed as RDD. Recurrent depressive disorder is characterized by repeated episodes of depression without any history of independent mood elevation or the overactivity. So completely the person has got the depression. Repeatedly he will be experiencing the depression without the symptoms of elevation in the mood or the overactivity. So if you take the recovery of this kind of recurrent depressive disorder, so complete recovery will happen between the episodes of the depression, but there are about 30% of patients who will have the recurrence of this depression, which will lead to a condition called as persistent depressive disorder. So before a person gets into this kind of a disorder, persistent depressive disorder, you would have had a recurrence of the depression. So recurrent depressive disorder the person would have experienced later he ends up with the persistent depressive disorder. The next type is the seasonal affective disorder. As the name says, in the particular season, the person will have the disturbance in the mood, especially the depression. So, during the winter months, early winter months, the person will have a depression in his mood, but during the summer season or spring season, his mood will be normal or will be elevated in his mood. So, that is called as seasonal affective disorder. Moving on to the next main condition, which is the dysthymia, otherwise it is called as dysthymic disorder. So what is this? It's a chronic, milder form of depression which does not fulfill the characteristic feature of the recurrent depressive disorder, especially in terms of the severity. Okay, so that kind of a disorder is called as the dysthymic disorder. So if you go across such kind of patients, they suffer from the normal, mood, which will be lasting for few days to few weeks, but later on they end up with the depression. So we can say that at times they feel very tired and they feel very depressed. Let us see the meaning of dysthymia. Dysthymia or dysthymic disorder is a milder form of depression, as I told you, which will last for about 2 years in case of the adults. So, the person will experience the mild form of depression for about 2 years or more than 2 years in case of the adults. And if you take in case of children, the milder form of depression that you can note in the children, which will be lasting for about a year. Let us see the causes of dysthymia. So we have the causes related to the environmental factors, biological factors and the psychological factors. So what are those environmental factors which is contributing to dysthymic disorder? Environmental factors such as family who is having a very poor coping mechanisms or the coping abilities, low level of communication within the family and inconsistent emotional support. So if a person is staying in such kind of an environment or in such kind of the family, then the person may end up with dysthymic disorder. The next factor which is contributing to dysthymia is a biological factor. So the biological factors includes the disturbances in the sleep. If the person is experiencing any kind of a sleep disorder, certain disturbances in the neurotransmitters, so especially the serotonin abnormalities and also the regulation of mood. So that is about the biological factors. Moving on to the third one, which is the psychological factors. Psychological factors includes the stress during the adolescent period or during the childhood period. For example, it can be the isolation or the lack of support that the person had experienced during the early childhood period or during the adolescent period. So that is what is a psychological factor which is contributing to the dysthymia. Moving on to the common symptoms of dysthymia. What are the signs and symptoms of dysthymia? The person will have a low or high appetite. So both the extremes, the person may have poor appetite or the high appetite. The person will experience fatigue and a low level of energy as well as insomnia. Because of this feeling of low level of energy, insomnia, the person ends up with a complication of feeling of negativity towards his own self as well as low self-esteem. So that is about the dysthymia. So dysthymia is a minor form of depression that you can note that the person will experience for a period of 2 years or over in case of the adults, and in case of children and adolescent period or the teenage period, the person will experience minor form of depression for about a year. Moving on to the next condition, which is called as the cyclothymia. There is a persistent instability of the mood involving the periods of mild form of depression and mild elation in the mood. So this kind of a disturbances in the mood usually develop during the early stages of development and can chronically lead or move on during the adulthood or the adolescent period. The mood may become normal and stable for some months during the state. Okay, so that is a cyclothymic disorder. So you can note that when you go and interview such kind of a person with the cyclothymic disorder, they do ventilate that their mood swings are often unrelated to the life events. Okay, so whatever events or situations or transitions that happens in the life of the person and the mood swing, there is no relation at all. So that is what that they may express. So what is the cyclothymia? Cyclothymia is nothing but it is a persistent mood disorder wherein the client will experience a milder form of depression and milder form of the mania, otherwise we can call as hypomania, right? So moving on to the etiology of the cyclothymic disorder. Number one is a family history of major depression, bipolar disorder, suicide, alcohol or drug abuse. Then we have got the idiopathic genetic risk factors. Will have a comorbid condition, especially the comorbidity is between the bipolar disorders, and there are some triggers or events in their life which will contribute to the cyclothymia. So what are those comorbidities that you can note with the cyclothymia? In case of children and adolescent, along with the cyclothymia, the child or the adolescent may also have the other conditions or comorbidity of anxiety disorders like generalized anxiety disorders, panic anxiety disorders, OCD, that is obsessive compulsive disorders, impulse control disorders or issues, eating disorders which includes anorexia nervosa and bulimia nervosa, pica, and ADHD, attention deficit hyperactivity disorder. In case of the adult, cyclothymia can be a comorbid condition with the condition, especially the impulse control disorders, that is gambling and compulsive sexuality in case of men, compulsive buying sprees and binge eating in case of the women. So you can note that a person who is having the cyclothymia can also have a comorbid impulse control disorders even in the adult group of the population. Moving on to the clinical features. So clinical features of the cyclothymia is mainly categorized into two phases or two kind of the symptoms. So one is the milder form of depression and milder form of the mania, which is the hypomania. So let us see the depressive symptoms in the cyclothymia. It includes feeling of hopelessness or sadness, loss of interest in the favorite activities or pleasurable activities, becoming easily tearful even for the trivial matters. They feel very emotional, they feel to cry. They'll have the irritability as well as the restlessness, changes in the weight, it can be the overweight or underweight, feeling of guilty or worthlessness, the person just feels that he is hopeless. He may also have a sleep disturbance, it can be the insomnia. He always feels tired or fatigued. He may have problems with the concentration and also the thoughts of suicide or the death. So these are the symptoms that you can note if the person is having the depressive symptom in the cyclothymia. If the person is having the mild form of elevation, or we can say the or we can say the hypomanic condition, then what are the symptoms that he will experience? He will experience a sense of euphoria or the sense of happiness. He feels extremely optimistic, positivity that he will feel in all the aspects. He will have an inflated self-esteem or the feeling of delusion of grandiosity, over talkativeness. He makes a very poor decision and partakes in the risky activities. He'll have the racy thoughts, flight of ideas that he may have, and he can easily get distracted. He cannot complete a particular task or concentrate on one particular task. He'll have the excessive physical activity, that is psychomotor activity will be increased. He feels irritable and agitated, and also his sleep may be disturbed. So you can note these symptoms of hypothymia which can be present. This disturbances in the sleep, usually less than 3 hours, that he may require for a sleep, right? So these are the symptoms of the cyclothymia based on the current episode, whether he is having the depressive disorder or the hypomanic symptoms. right? Moving on to the treatment of the persistent mood disorder. So, what is the treatment? So, since most of these treatment include the use of psychopharmacological agents, the physical therapies and ECTs, so here also we have got the same. So, what is the psychotherapeutic agent that we use? We use the antidepressant drugs. So that is a treatment of choice. Apart from this, going to give the therapies to the person, one is cognitive therapy. Now, why cognitive therapy? You need to change the cognition of the patient, right? He'll have the feeling of helplessness, hopelessness, worthlessness. Okay, so negativism, pessimistic way of thinking. So you need to bring about a change in the cognition. So you make the patient to undergo a cognitive therapy to correct the depressive, negative cognitions like the hopelessness, worthlessness, helplessness, and pessimistic ideas, and replacing them with new cognitive and behavioral responses. The next therapy is the supportive therapy. So, in the supportive psychotherapy, you have to see to it that the patient gets a emotional support. Various techniques that we use in the supportive technique, like reassurance, ventilation, occupation therapy, relaxation, and the activity therapies. Okay, so that is what is done in the supportive therapy. Apart from that, you will ask the patient to involve himself in the various kind of the meditation or relaxation techniques like yoga, physical exercises, stress therapy, group yoga therapy, leisure education, how to use the leisure time, how to use constructively, make use of the leisure time which is available for the client. So you will be organizing the yoga sessions at least twice in a week and see to it that the patients participate in the yoga therapy. So that is about the treatment options available for the persistent mood disorder. Moving to the nursing management. So what are the nursing diagnoses that you can state for this condition? Number one is risk for other directed violence, risk for injury, imbalanced nutrition less than body requirement. So based on the symptoms of the patient, whether it is a depressive symptom or a hypomanic symptoms, these are the nursing diagnoses that you can state for these conditions. Ineffective coping, ineffective role performance, self-care deficit, chronic low self-esteem, disturbed sleep pattern. Okay, so these are the nursing diagnoses that you can list up. So what are the nursing interventions? First thing is the provision of safety. You need to make sure that you provide a safe environment to the client free from all the hazards, because a person with depression can end up with suicidal ideas or plan for a suicide, right? So see to it that you provide a proper safe environment to the client, the comfort for the client. Meet the physiological needs of the client. So the basic needs of the client that you got to meet, it can be the nutrition, can be the sleep, right? Self-care. So all these basic needs has to be met. Promote the therapeutic relationship. So in case of depression, the person will not interact, the person will have problems with the communication, he will isolate himself. So involve the patient in the group activities so that he will socialize and he will try to communicate. So thereby promoting the therapeutic relationship. Promote the activities of the daily living. Provide the physical care for the patient. Promote the appropriate behavior for the client. So when he shows an acceptable behavior or a positive thought, okay, so you need to encourage and reinforce the positive behavior, right? So you're going to uplift the client's mood, and you're going to uplift the client himself. You need to manage the medication therapy. So you need to see to it that the client takes the medication and follows the appropriate or accurate medication regimen. Also, you have to provide the education to the client as well as the family. So education in terms of the condition that they are suffering from, you need to educate the family to support the client and come for a follow-up visit, and not to abruptly stop the medication therapy, and to be always a helping hand to the client so that he can lead a normal life, right? So you understand by the persistent mood disorder, it is that continuously the person will experience the disturbances in the mood. Either it can be a depression or it can be a milder form of the mania. Very important to recognize that and to see to it that you take the client to appropriate therapist. Hope you all have understood the topic. Thank you.